Good afternoon, everyone. It is my great pleasure to welcome you to our session today titled Hands On with QuickRes Optimizing Health Service Delivery in Africa with an Available Telehealth Application. My name is Abraham Simmons, and I'm a technical advisor at FHI 360. Our session aims to introduce you to QuickRes, an innovative web application designed to enhance the accessibility and efficiency of health services through telehealth. We will explore how QuickRes is being utilized across Africa to support clients in HIV treatment and PrEP, showcasing two real-world case studies that highlight its impact and effectiveness. Today, I am being joined by my esteemed colleagues and experts in the field, Isabel Mendes Sayamba, who is the Chief of Party for the KP Star Project in IntraHealth Namibia, and Lynette Marimba, a Senior Program Manager at the WITS Reproductive Health and HIV Institute. We say WITS RHI. Isabel is a Health and Economic Development Specialist with over 13 years managing health programs in Namibia. Her expertise includes HIV prevention and treatment, sexual and reproductive health, OVC care, TB, malaria, and WASH. Isabel excels in managing stakeholders and has a strong track record with donors like the Global Fund, USAID, and Namibian Health Authority. Lynette is a Senior Program Manager with RHI for the Go for Like program, supporting South Africa's Department of Health in HIV and TB treatment and prevention. She has a Master's in Educational Psychology from the University of Pretoria and a Master's in Social and Behavioral Studies in HIV and AIDS. She has over 15 years experience in public health, specializing in HIV/AIDS management, OVC care, sexual and reproductive health, and educational psychology. Now, for this session, we want to introduce you to QuickRes, our web application for online appointments and case management, and review these two case studies with you of how they're being deployed in Africa. Now, QuickRes is an online reservation and case management application, or ORA. It's accessible via web browsers on computers, tablets, and smartphones, and it supports a wide range of health services, including HIV, STI, family planning, violence prevention, mental health, and COVID-19 services. It provides interface for clients, providers, case managers, and program managers. The app ensures client confidentiality and data security through secure hosting and novel security functions like client information encryption. ORA can be deployed for specific countries or project, or as part of an existing multi-country deployment, which is QuickRes. Its value adds includes engaging clients in self-care, facilitating virtual consultation, and decentralized service distribution, supporting live data entry and use, and offering a custom-built, easy-to-operate solution for all users. Tailored to implementation further ensures confidentiality through user training and limited collection of sensitive information, making QuickRes a comprehensive, secure, and adaptable tool for modern healthcare management. So on this slide, you will see where the system has been or is currently being used. QuickRes is actively used in 24 countries around the world with a strong presence in Africa, spanning roughly 18 countries. On this slide, I am reviewing some of the key functions of QuickRes with you, particularly those relating to the client-facing functions that run at the top of this chart in parallel to those provider-facing functions. Now, clients can assess their service needs using a self-guided assessment tool, and they can also screen for other health risks such as COVID-19. They are also able to directly book health services and request services to be delivered to their home or virtually. They also receive automated appointment reminders and have access to tools that help them to refer their peers and partner for services and record their satisfaction or complaints as they access services in each instance. On the back end, providers are able to edit and control their own clinic information. They can record and monitor appointments on behalf of clients, and they have utilities that also help them to monitor requests for certain service delivery, to like home delivery or for virtual consultations. More importantly, you'll learn today in this presentation how QuickRes facilitates case management, particularly for ART and PrEP, and how the system generated results have been used to improve program quality and share insightful data for others who would like to use QuickRes. I have included in this slide a very quick demo of the client-facing functions of QuickRes.
Welcome to the new and improved QuickRes, a web application for booking health services and streamlining case management across multiple countries. Access QuickRes securely by visiting quickres.org. Review our updated terms of use policy to see how QuickRes is used in your country. Be sure to use the self-assessment tool to get recommendations for the right services for you. If you need support, start a live chat on QuickRes. We can connect you to people over secure messaging platforms like WhatsApp and Telegram from the convenience of your own phone. Use the Book Services section to directly access the services you want. We offer various health services based on availability in your area. When booking, first select the desired service. The options are shown based on what's accessible from your location. For some services, you are asked to choose your preferred modality: in-person, delivery, or virtual session. Next, pick your preferred provider. Specify your location for a more precise list. Keep in mind that providers include facilities, but may also include individual professionals. Select your preferred date and time. Some providers may arrange this directly with you instead, so you may not have the options to choose date and time right away. Appointments can be booked up to 6 months in advance. Confirm the details of your appointment, which you can edit by clicking the pencil icons. You can modify the selections throughout the booking process. Enter a name and phone number so we can contact you about your appointment. If preferred, you can opt out of receiving phone or text reminders. Next, answer a few brief questions and prove you're human by entering the code shown. Finally, accept the terms of use, submit the booking, and screenshot the confirmation. Be sure to mention you booked through QuickRes when visiting your chosen service provider. Refer others for services through QuickRes by clicking the Refer Someone icon. QuickRes, simple, confidential access to nearby health services.
On screen, you are now seeing a snapshot of the provider-facing appointment features. Providers can view and edit or reschedule client appointments, report when clients have arrived for their appointments, and document the health services that have been provided to the clients. They also can assist clients with post-service options like providing client feedback and referrals for partners and payers. QuickRes itself is complemented by various telehealth approaches that help to stimulate demand for HIV services, deliver HIV services, and retain those clients that are enrolled on treatment. We encourage this 6-point framework as a point of reference for programs looking to implement QuickRes within a broader framework, where they have methods to help them identify their audiences online, plan for their outreach modalities, conduct online outreach or market their programs and QuickRes, and then use QuickRes as a tool to help with referrals, service delivery, and virtual case management. And as previously mentioned, QuickRes itself has built-in data visualization and data export functionalities that can help with quality monitoring and quality improvement. That would be the end of my presentation, and at this point I'm going to be handing over to Lynette, who will do her presentation.
Hello everyone, my name is Lynette Murimba. I'm with the First Reproductive Health and HIV Institute in South Africa. I'm presenting on the innovative approach of virtual art treatment navigation model using QuickRes under the Hopeleka project. Just to provide a brief background on the First Reproductive Health and HIV Institute Hopeleka project. This is a PEPFAR CDC care and treatment project implemented in Gauteng province, South Africa by the First Reproductive Health and HIV Institute. The project focuses on care and treatment for people living with HIV and TB, general population, in 99 public health clinics. VIS Reproductive Health and HIV Institute contracted FHI 360 to pilot virtual case management using QuickRes in 7 government clinics from January to December 2023 and expanded to 40 clinics in January 2024. Treatment navigators use QuickRes to enroll patients starting at, schedule at refill appointments, refer for psychosocial support, send SMS appointment reminders, collect patient feedback, and track patients' retention until viral load suppression. Why QuickRes? It was chosen to address several challenges faced in ART retention and management, particularly in the first 6 months. Treatment navigators were struggling with the inefficiency of using paper registers to triage clients for support. Treatment navigators cannot directly access tier.net, the Department of Health's Health Management Information System, which limits their ability to manage patient information effectively. Tier.net does not offer dynamic appointment scheduling for clients, making it difficult to manage and adjust appointments based on clients' needs. Using QuickRes presents several opportunities for improving ART retention and management, as it engages clients in their care through their phones, capitalizing on South Africa's high mobile connectivity and substantial internet penetration. QuickRes increases the efficiency of treatment navigators by replacing cumbersome paper registers, allowing them to provide better support. It works alongside with the existing facility-wide tier.net system, enhancing functionality without replacing it. In our program, QuickRes is used by treatment navigators to enroll ART patients in an enhanced case management program called treatment navigation. In this approach, treatment navigators enroll clients on QuickRes as soon as they are initiated or restarted on ART at a facility where the team uses QuickRes. QuickRes tracks each client's ART refill appointments and attendance until viral load suppression. Clients are screened and referred for psychosocial counseling either in person or by the phone. Virally suppressed clients graduate and return to standard care. Those with unsuppressed viral load continue under treatment navigation support. Treatment navigators use QuickRes to book appointments and track clients' status with SMS reminders sent to the clients. Here are some of the key results from the program since launch in January 2023 to mid-June 2024. A total of about 23,000+ appointments were booked on QuickRes for ART, viral load, and counseling services. 82% of all past appointments arrived, totaling to about 17,000 successful appointments. Higher attendance of ART services were noted as compared to counseling services, of which 36% of counseling appointments were phone-based. If you look at the right, you can see that a total of 5,211 patients were enrolled in QuickRes for treatment navigation, and among those added to the cohort, about 3,046 are still open and being actively followed by treatment navigators, as shown in the green bar. And 51% of these open cases represents clients who have got ART stock. The remaining 49% are without ART stock, which means those clients either miss their ART refill or actually virally suppressed and should be closed by treatment navigators on QuickRes. These are quarterly results showing indicators that blue bar, overall appointments for ART enrollments and refills, and the green bar, new clients that are added to the ART cohort on QuickRes per month, and the blue line, ART appointments attendance per month. And you can see that there is an increase in terms of ART appointment volume starting in Q2 2024 after expanding from 7 pilot sites to 40 sites. Q3 FY24 is the current quarter and the data is still ongoing. Here is a summary of the client feedback on ART services as well as treatment navigators. feedback on the use of QuickRes. In terms of client feedback on art services, we received feedback from 151 patients and average satisfaction rating 8.5 out of 10. We received 20 complaints, and common complaints included private issues, waiting times, and staff friendliness. VESA is compiling this feedback to share with facility management teams for further actioning. In terms of treatment navigators' feedback on the use of QuickRes, 82% of treatment navigators are very likely to recommend QuickRes to other TNs who are using paper registers. 92% of treatment navigators consider QuickRes extremely helpful compared to paper-based tools. Both treatment navigators and clients welcome automatic reminders sent by QuickRes. Most treatment navigators consider QuickRes helpful in improving appointment attendance and art retention. In conclusion, QuickRes is positively received and beneficial in improving the workflow and outcomes for treatment navigators and clients. Here are some of the key lessons and next steps. Despite power outages and mobile data coverage challenges, QuickRes benefits outweighs those of paper-based tools. Patients can access SMS reminders and notification anytime, even after hours, enhancing their engagement with the program. Patients can provide feedback on services and submit complaints using a simple patient feedback survey embedded in QuickRes, enabling a more responsive system. Treatment navigators reporting on QuickRes is still suboptimal, especially for closing cases for clients who interrupt, die, or are virally suppressed. The team is addressing challenges to capacitate the program's strategic information staff to directly support treatment navigators in completing records on QuickRes.
Thank you very much for your presentation, Lynette. We will now go straight to Isabel for her presentation.
Okay, good morning, good afternoon. My name is Isabel Mendes Siamba. I'm the Chief of Party for the key population project known as KP-STAR, implemented under the leadership of IntraHealth Namibia and also funded by USAID. Maybe just before I give a brief overview of IntraHealth Namibia, my presentation will be based on the role of visual case management and QuickRes in PrEP support in Namibia. So going back on what IntraHealth stands for, what IntraHealth is all about. IntraHealth Namibia is a local non-profit organization that supports the Ministry of Health and Social Services in the provision of health services. The organization provides health information to communities, mostly in the areas of HIV and TB, and also by assisting people to receive health services such as HIV testing, linkages to treatment, PrEP, and family planning, among others. IntraHealth Namibia is implementing various projects that target key population, adolescent girls and young women, and also general population. The organization also works with stakeholders at all levels of society, including the Ministry of Health and Social Services, Ministry of Gender Equality and Child Welfare, and the Ministry of Education, Arts and Culture. More about KP-STAR project, or this slide will give a project overview of the KP-STAR project. It's a USAID-funded initiative enhancing HIV prevention and treatment for key and vulnerable population in Namibia through clinical and community-based services. The project objective for the KP-STAR project is to increase access to comprehensive HIV services for key population and men who purchase sex, strengthen the capacity of KP-led CSO or civil society organization and key stakeholders to advocate and implement KP-focused HIV activities, improve data management system for effective planning, monitoring, and quality assurance. The challenges that we have in the implementation of the project includes COVID-19 disruption. The pandemic created significant barriers to traditional in-person health delivery, necessitating innovative solution to ensure continuity of HIV services. We also experience stigma and discrimination. Key populations such as female sex workers, men who purchase sex with men, and transgender individuals face social stigma and discrimination, hindering their willingness to seek HIV services through traditional means. Data management gaps. There was a reliance on paper-based tracking system, led to inefficiency and delays in data collection, impacting the ability to provide timely and coordinated care. Resource limitation, ensuring the availability of trained community-based case managers and healthcare personnel to support the scale-up of visual case management services across multiple regions. Finally, the last challenge include consistency in care, maintaining high engagement and adherence rate for PrEP and ART among KPs in context of fluctuating healthcare access and support. Um, Given the challenges that I just emphasized, we tend to come up with solutions which included visual case management, a new hybrid engagement model combining traditional and visual approaches for client support. We focus on community-based framework to support people accessing PrEP and ART, empowering clients through automated SMS reminder and visual flows. QuickRes platform, launched in 2020 in Namibia, QuickRes facilitates visual case management by providing interactive intuitive electronic system. This platform supports case management, triages clients, and ensure continuity in care, helping achieve the objectives of the KP project. A client-centered approach. Through QuickRes and visual case management, clients were able to have dedicated visual hybrid support from community-based case managers who were integrated into treatment sites, book appointments, or have appointments created for them. This enables clients, even with simple cell phone, to benefit from visual support. Refer peers and partners for HIV-related services, receive SMS and phone-based reminders for PrEP and ART refills, and provide feedback on services. This slide look at the result of all appointments done from October 2020 to June 2024 in 75 sites across the country, specifically in 10 PGAs where the project is being implemented. Overall, for all services, there were 36,650 appointments recorded through QuickRes. A total of 26,824, which represents 74%, were marked as arrived. This included a mix of sessions for PrEP, initiation, refill, or restart. The data does show that the number of PrEP initiation is generally higher than the number of refills across the 8 quarters. There is a distribution of higher PrEP initiation compared to refills, while refills number started consistently averaging around 361 per quarter. There's a noticeable decline in the later quarter. We closed the gap on the number of restarts. Our next steps are as follow: expand the use of QuickRes in private clinics or facilities, train private doctors on the use of QuickRes, create demand for QuickRes online through the KP project social media handle called self-paced, efficient, equitable Namibia, or seen in short, which is managed by IntraHealth Namibia. Use QuickRes to get feedback on service delivery at public health facilities. Continue to advocate for the rollout of QuickRes to the Ministry of Health and Social Services Public Health Facility. Thank you so much.
Thank you, Isabel. At this time, we can take some questions from the audience. Thank you all for joining our session. We have come to the end of our workshop, but we have here a link or QR code that you can scan to join our community of practice on WhatsApp for the latest updates on our telehealth solutions, including QuickRes. Just send the message that you see on screen and we'll be happy to share these slides that were presented today as well as any additional resources that can help you in designing your telehealth program. Thank you.